Thank you, Mr. Chairman. We were promised affordable care. What Americans got was unaffordable premiums, sky-high deductibles, and bureaucrats standing between patients and their doctors, all while American people get sicker. I said back in 2018 that Obamacare was a flawed, broken system, and I was called a fearmonger. So let's stop arguing about intentions and talk about results. Under this system, families are punished if they stay healthy, and they're financially devastated if they get sick. That's not health care, that's sick care. Since the Affordable Care Act passed, wages are up 26%, but deductibles are up 160%. Premiums are up nearly 80%. The average family now pays around $24,000 a year for health insurance, more than many families pay for their mortgage. Some are paying $30,000, $40,000 and still rationing care. That's not a safety net, that's a hangman's noose. So let's start with a very simple question for some very smart people here. Raise your hand if you believe that healthcare today is affordable for the average American. No hands, so we have agreement. I believe it's unaffordable because nobody knows what they're paying for. The only way we can have affordability in this country is if we have accountability. And you all must be accountable to the American people. President Trump made this clear in his great healthcare plan. You must post your prices so patients can see them. So I'll ask you again plainly, yes or no? If you're buying a plane ticket, you know how much it costs? Yes, you know how much it costs. So why in healthcare do we hide our prices? You only hide things if you don't want people to know what you're doing. Will you commit to publishing clear, complete rates, side-by-side coverage comparisons that employers and families can actually understand in the same places that you price your bills? I see one head nodding.
We're already doing that.
Already doing it?
Already doing that.
Well, it's not having desired results. We need to do better. We need to stand behind the transparency data with the same seriousness that you expect patients to pay you back. The American people were promised affordable care. What you've given them is higher costs and worse health outcomes. After more than a decade, Americans are a heck of a lot sicker and a heck of a lot more insured at the exact same time. How does that happen? Your incentive structures must change. You must be held accountable, and you must change course. The American people are done with it. I'm done with it. I'm speaking to all my colleagues on this committee. We have to hold these companies accountable, and the best way to do this is through transparency. My bipartisan and bicameral Patients Deserve price tags bill does exactly that. Please give the American people your support. Thank you, Mr. Chairman. I yield.
Gentleman yields back. That concludes the questioning section of this hearing. I ask unanimous consent to insert in the record documents included on the staff hearing document list and those that brought up during the meeting.